InciSioN is a network of young medical students and doctors advocating for a better access to surgical care all over the world. As future surgeons of 2030, we understand that to have a better access to surgery, we need to strengthen the entire health system. We also understand that we need a multidisciplinary approach involving other sectors as well. Indeed, to have access to an operating room, one needs safe roads, a climate of peace, clean water and sanitation, and a well-educated, gender-balanced and decently paid workforce. I will let you with my friends who will give you a better insight to the work we do, but we do understand that advocating for surgery is basically advocating for the Sustainable Development Goals. Thank you.
We InciSioN work for safe surgery all over the world. Let's make the world no one left behind.
InciSioN plays a very valuable role in supporting Sustainable Development Goal number 5, gender equity, by advocating for timely, affordable and equitable access to obstetric care around the world.
We promote safe and timely surgery in the world, which affects youth mainly in developing nations such as Burundi. We therefore rid the youth of surgical disease that will prevent them from accessing jobs and contributing to the economic growth of their nations. Thank you, InciSioN, for this opportunity.
As a medical student, being involved in InciSioN work enables me to be a young advocate for women's health and women's education. These are important pillars in reaching gender equity.
Our organization brought $400,000 worth of medical and surgical supplies to the hospitals here in Grenada. We also promote eliminating inequalities by educating future physicians via our wound clinics and research projects.
We live in a country when you don't have money to go abroad, search for medical or surgical services, and you are poor to afford that prices to go abroad, you go in palliative care, no other choice. And it happened to many people, so that show how inequality still exists in like developing countries. And here in Rwanda, what we try to do here, like InciSioN in Rwanda, we do advocacy, we show the people, pick up that.
InciSioN Croatia aims to contribute to economic growth of our country by developing medical innovations, improving working conditions for all medical personnel, and advancing our healthcare system. Investing in human resources for health is proven to increase economic growth.
Advocating on global surgery is bidding on the new ideas and talent that our generation offers. In Latin America, the inequality of access and coverage in surgery mainly affect the vulnerable and poverty population. In my experience in rural communities, I have observed that access to minimally invasive surgeries allow rapid recovery and reduce hospitalization expenses. This represents a point in favor of the economy of highly productive territories.
InciSioN has changed the way I think. Before, when faced with an issue in the Egyptian health system, I usually felt this way, but now I think, how can I improve the situation? How can I solve the problem? InciSioN has made me a better medical student and a better future health professional.
Through advocacy, we created the first Somaliland surgical network, and currently we are developing the first anesthesia network in Somaliland. All of this was just to share the resources in the country and end inequalities.